Well, that's what we're trying to figure out. Just first name, that's all you want? Okay. Hi, I'm Katrina and I research cardiovascular disease at Monash University. Cardiovascular disease is the leading cause of death worldwide. What's not commonly realised is that more women than men die from cardiovascular disease, and women are actually 3 times more likely to die from cardiovascular disease than they are from breast cancer. Women are protected from cardiovascular disease prior to menopause. We're trying to understand why they lose that protection after menopause. And so one of the things that we're interested in is understanding why more women than men die from cardiovascular disease and why these deaths occur 10 years later in life in women than in men. High blood pressure is the greatest risk factor for developing cardiovascular disease, and so we're trying to understand why there are differences between males and females. There are a couple of risk factors for high blood pressure that are unique to women. And so one of those is pregnancy. In a lot of ways considered a stress test for cardiovascular disease, and it's a window into the future. So if you have complications such as pre-eclampsia, which is the severest form of high blood pressure during pregnancy, that can actually increase your risk of developing cardiovascular disease in later life. Historically, it was thought that males and females were equal, and that anything that worked in a male should therefore work in a female. We know that women and men do not present the same way for cardiovascular disease. Women do not experience the same symptoms of a heart attack as what a man does. They may go to their doctor complaining of what's called atypical symptoms for a heart attack, and it may not be taken as seriously. This actually has a name, it's called Yentl syndrome, based off the Barbra Streisand movie where she actually dressed up as a man in order to receive an education. And so Yentl syndrome was the name that was given to describe this effect with women who were experiencing a heart attack. We also know that because there is a delay in detecting cardiovascular disease, there's then a delay in treatment. So women often then have worse outcomes. Really what our research is then doing is going back to the basics. So going back to the building blocks and really understanding the systems that are fundamental for control of your blood pressure, how your heart functions, how they differ between males and females. Because if we can understand that, then we can use that information to provide better quality treatment, and it really leads into personalised medicine. So what a woman receives to treat her cardiovascular conditions may not be the same as what a man receives. Taking into consideration the fact that women have different risk factors for cardiovascular disease, pregnancy complications, and also menopause, they may require different treatment and obviously at a different age. So really it's about re-educating both the public as well as the clinicians with our latest research and what that means in terms of patient care.